Good afternoon, everyone. I hope you're all well, and welcome to our Autism and Young Onset Dementia webinar for the Young Dementia Network this month. My name's Professor Louise Ritchie, and I am a member of the Young Dementia Network Steering Group, and I'm chair or co-chair of the Research and Knowledge Workstream for the Young Dementia Network as well. I've got the pleasure today of chairing the webinar. We have two speakers this morning, and we have a video from Lou, who's a carer. The reason I'm chairing this morning, you'll be used to seeing Tessa, who was the chair of the Young Dementia Network, usually chairing these webinars. Tessa has retired, and Hilda Hale is the new interim chair of the Young Dementia Network, who's on holiday, so has asked me to do this. So hopefully I can do Tessa and Hilda justice in the chairing today. So before we start, I'll just remind you, this is our first webinar that we've used Teams for, so it's the same as the Zoom functionality. Nobody who's attending the webinar is on audio or camera, so please use the chat function to chat between yourselves. But if you have a question for any of the speakers today, could you please put it in the question and answer box, and we'll pick them up at the end. I'll now hand over to Catherine, who's going to play a video of a recording between Ryan Gray and Lou Clark, who is a carer for her mum. Lou has autism and is going to talk about her experience of caring with Ryan. So I'll hand over to Catherine now.
So could you tell us a little bit about your journey as an autistic carer for dementia and how autism has influenced how you care and your care needs?
I was very happy to move back home to my parents' house to help my mum look after my dad. But I found I was so overwhelmed with the sensory input that I didn't normally have in my home environment. I found that quite challenging. It sent me to look into why I was being affected so badly, and I have, after 6 years, ended up with an autism assessment and diagnosis, and that's explained an awful lot for me, because I was spending all of my time in the shed where I could meet my own sensory needs, and then when my mum and dad needed help with something and I'd pop in the house, it was a little bit like maid service. Being autistic meant that although I was very reluctant to go to the doctors for my own health needs, I was very on the ball with helping my mum and dad with their health needs. We did have support from the community nurses, who were absolutely fantastic. But it's all quite scary as time goes on and you get bombarded with various diagnoses to know where to get help and support and which is the right help and support, and your autistic brain goes into a little bit of a spin, and I think it makes it even more overwhelming and challenging because you're so keyed up to doing the right thing for the person that you're looking after, whilst totally neglecting yourself and not even considering the fact you haven't slept through for 3 years. It's quite a strange, lonely world that you find yourself in. And every time you meet professionals, you tend to just put a brave face on things, give them the impression that you are coping, and you possibly are coping with your caring role, but not necessarily your own personal role of taking care of yourself.
Mm-hmm. Mm-hmm. And other than the shed, do you have any, coping strategies that you try to bring into your life?
I'd been totally doomed if I hadn't had the support of a good friend that was able to help me with shopping, help me with just general guidance of trying to find my way through all of the information that's out there and sifting through what was relevant and what could be useful. and the emotional support, because if you're not going out and socialising and your whole life is geared up around caring, you do need to have somebody to point out to you that you need to eat a decent meal, and you need to try and get a good night's sleep, and perhaps start looking for somebody to help you in your role. The outside support is so important, and it can simply be a close family friend.
Okay, so you've also spoken about realizing your mum might be autistic, and finding this out after her diagnosis of dementia. So what led to your or to this realization?
I did 4 years of attending Zoom meetings with the Community Autism Support Service, where they educate you about autism, how it can affect different people in different ways. And it's when you work it to the relevance of yourself, you can't help but look at other family members and think, well, that's strange, because whereas I can't cope with bright lights, my mum has always been lights here, lights there, loud noise. And I started to build up a sensory profile for my mum that was the polar opposite from myself in my head. And it gave me a greater understanding of how we would clash sometimes and why we would clash. And it was just simply a difference of needs. But when our house was flooded and I had to suddenly try and find somewhere that was able to look after my mum and meet her needs while the house was put back together, it was impossible, because it wasn't just the care needs that I was having to take into account for my mum. It was the fact that she lives in a house that is whitewashed and very Spartan. She's very particular about her environment, her lighting, her television that she watches, so particular about cutlery, all these little things that you don't notice in everyday life until you're about to take somebody out of their environment and put them in a different environment. And what shocked me was when I contacted social services to ask if they could point me in the direction of any suitable places that could look after my mum on a temporary basis. They had less knowledge than I had. I had spoken to over 100 care homes, nursing homes, groups, trying to find suitable care. The result was that my mum ended up 150 miles away to somewhere that really meets her needs exceptionally well. The staff there are very understanding of my sensory needs. I have found them extremely accommodating, but I think that is because they are a nursing home that employ an admiral nurse. They specialise in dementia. They specialise in invisible disabilities. They're used to people's randomness. They aren't easily shocked. And that is very, very comforting.
Mm-hmm. Mm-hmm. Good.
And it is an awful experience when you are coping at home and something happens and you're suddenly not coping at home and your loved one needs to go into a care facility. It leaves you feeling so bereft. It leaves you so anxious. This is beyond your control, but the worry that you have because you're letting them out of your sight and you are no longer in control of that situation. You are no longer in control of giving them the medication, double checking everything. It is such a huge gap that is left. I can't express to you how coping with that, when I look back on it, coping with that was harder than coping with the 24/7 caring role.
Mm-hmm.
Way that it just annihilates you emotionally. A feeling of failure, whereas you haven't failed. It's circumstances beyond your control. But it's very difficult when you're unable to explain that clearly to somebody and for them to comprehend what's happened.
Is there anything that a key thing that you think that healthcare professionals should understand about supporting someone with both autism and dementia, and to support autistic carers as well? Is there any key message that you would like to give?
Having a diagnosis makes no difference to somebody's sensory needs. Invisible disabilities are very, very real for people, and I feel that professionals need to take more notice of input from family members. There are so many people of my generation in their 60s and in their 50s that are going to be autistic, that aren't going to have a diagnosis, that are going to suddenly find themselves in a situation of needing a care facility in the future. And if people have additional needs to those that you normally come across, if a family member makes you aware of them, I suggest that they take notice of what is said. And I think that the NHS passports to health are a great way for the family to fill in a bit of paper and pop it under somebody's nose as they're meeting new professionals. I think a paperwork trail is extremely important, especially within the NHS, when computer systems don't always link up. You don't always get a full picture of a person on a computer system from the NHS. It can be scattered over various systems. So the paperwork trail that a patient and the carers create themselves is absolutely vital. With autism, the Oliver McGowan training is extremely key.
Mm-hmm.
Because there are going to be situations where somebody may have a diagnosis for autism or not, but they will be aware that they've had reactions previously to medications. Some things don't suit them. They might have the odd allergy or intolerance. These things need to be taken very seriously by health professionals, because if you give medication to somebody and their immune system decides to encounter that as a threat and they're going to react against it, it can leave somebody not only chemically intolerant, but it can result in death. And the Oliver McGowan training is really to highlight how important environment and listening to families and taking note of medical history really is with autism.
If you want to just have the opportunity to talk about your new sort of perspectives since your mum's passing, and those realizations that you mentioned to me earlier, just obviously have kind of free reign to say what you feel, basically.
I didn't realise, whilst I was in my caring role, the amount of effort that I was putting in to respect my mum and my dad's wishes, where I was actually neglecting myself and my health and my general well-being. Now my mum has sadly passed away, and that weight of pressure of carrying out somebody's wishes, things that you've agreed to many years ago, and all you want is your best for that person, it puts you under a huge amount of stress. Until it's lifted off you, you don't realise the huge amount of stress that you've actually been under.
Mm-hmm.
It certainly isn't a relief of losing the person, it is a relief of not having that worry and responsibility. And I think that because of me being so sensory, being unable to have people come in the house and help me, the impact on my health, not having a decent night's sleep for 7 years and not even thinking about it. It's surprising. It's surprising when you look back and you think, how did I manage to do that? I think something that I would mention to the professionals out there is that when they're seeing people and they're writing their notes, these are the notes that are going to be referred to in the future by professionals. If a person ends up moving house, moving into a care facility, there are so many reasons to change doctors, and you're back to stage one again until the relationship's built up. So having that record on paper makes all of the difference in the world. And I would recommend to any patients, look at your medical notes, make sure you're happy with what's written down. Any errors, make people aware and they'll be adjusted. Look into the fact that respect forms, NHS proxy, lasting power of attorney for social care and for finances. These are all things that we always put off until, oh, we'll sort that out another time. But if you end up in a crisis situation like I did, you don't have time to think. If your house is flooded and you need to find care facilities quickly, you're in a really challenging situation if you haven't got the paperwork to back you up. So really it's being prepared for everything, every eventuality, I think. Just think worst case scenario and brace yourself for it. If you end up in that situation, things will be much easier for you if your paperwork trail is in place.
Yeah. Yeah, thank you so much again for doing this for us and for giving us your insights. And
it has been a lovely little bright light amongst all this darkness of chaos that I'm currently dealing with.
Well, I'm pleased to, but it's been some comfort to you.
Thank you very much to Lou and to Ryan for recording that video, and especially to Lou for sharing their experiences. It's so important that we ground any conversations that we're having in lived experience, so we're really appreciative. Lou isn't able to join us live today, but has said that if anyone has any questions, she's happy to follow up offline. So if anybody does have any questions specifically for Lou, please pop them in the question and answer box and we can follow up with you after the webinar. I'd now like to introduce Dr. Ryan Gray, who you've just seen on screen, who is a research assistant at Dementia UK, who's going to tell us a bit about the work that they're taking forward around autism and dementia.
Thank you very much, Louise. I'll just share my slides. Can everyone see those?
Yeah, that's great. Thank you.
Good. Thank you. Yeah, just to reiterate, Lou unfortunately couldn't be here today, but yeah, please do pop any questions that you have for in the Q&A, and we'll share those with Lou, and she'll write up a response that we can then share in the follow-up email after the webinar. But yeah, and again, thank you so much to Lou. It was a really profound experience talking to her and getting her insights from her experiences as a carer. So yeah, I'm Ryan, research assistant at Dementia UK, working primarily on the young onset dementia strand of our 2023 to 26 research strategy, but I also support on a variety of other projects, one of those being the development of resources about dementia for autistic people, their supporters, and for healthcare professionals. This was a collaborative project between ourselves, that's Madeline and I from Dementia UK, Amanda from Autistica, and Gavin Stewart from King's College London, who we'll be hearing from later on in this session. So just briefly, a little overview of autism. So it's a lifelong neurodevelopmental difference in how someone communicates, processes information, and interacts with the world around them. It's highly heritable, which means that it's strongly influenced by genes and so often runs in families. It's also what's described as heterogeneous, meaning that there's lots of variability between people and also that individuals' needs can change depending on their setting. And therefore there are strengths and challenges depending on the context. And this variation also means that there's a huge variation in the support needs and experiences of each autistic person. So some of those differences that I mentioned might include differences in communication styles and preferences, relationships and social situations, different needs in terms of routines, and as Lou put in during our conversations, differences in sensory needs and experiences that can obviously in Lou's and her mum's case be quite vastly different. In terms of prevalence and diagnosis in autism, diagnosis in adults is particularly older adults is really low. And some estimates suggest that 90% of autistic adults over 40 likely don't have a diagnosis. And last year there were 200,000 people on a waiting list for an assessment. Nonetheless, diagnosis has increased rapidly. Between 1998 and 2018, this increased by almost 800%, which could largely be to do with better diagnostic tools and techniques, increased awareness and understanding, including something called masking. So this would be where someone might camouflage one's characteristics or traits. One example might be someone forcing themselves to maintain eye contact when that's something that is usually uncomfortable to do. Autism's more commonly diagnosed in children and more commonly diagnosed in males as well. There's very little research on older autistic adults, with most research out there focusing on early years learning and development. Just 0.4% of autism research focuses on older adults, and therefore there's a limited understanding of how autistic people age. Here, I'd like to make this link quite tentatively. So in the US, some research has suggested that autistic people are 2.6 times more likely to develop dementia, specifically onset dementia, with some prevalence suggesting that for young onset dementia, it's around 4% in autistic communities compared to less than 1% in the general population. Yeah, like I say, I'll make that tentatively. I think we'll get more detail from Gavin's presentation about why we might see some of these statistics. So yeah, we don't really know how generalizable this is. However, as more first generation people diagnosed with autism are reaching older age, they are beginning to enter care services and residential homes, and therefore need older adult care services. And some of these services are underprepared for this, and underprepared in terms of managing both dementia and autism together. So again, I won't go into too much detail. I think we'll cover this some more later on in the session, but some autistic traits can be mistaken for early signs of dementia. Dementia can be overlooked or misinterpreted as autistic traits. Masking of traits can mean dementia is missed. Both conditions can affect executive function. So this is a series of or a set of cognitive functions involved in planning, problem solving, learning, and also the kind of consolidation of memory. And there are no specific tests available to diagnose dementia in autistic people. So this led us to our project. We aim to look initially for some resources about autism and dementia together to help inform Admiral nurse practice. And as you can see here, we found very little in this area. There were plenty of resources for each individually, but not together. So limited information in terms of identifying symptoms and understanding how best to provide care. So this led us to our project in full. So we aim to provide some resources about autism and dementia together. And these were aimed at two audiences, so autistic people, their family members and supporters, but also professionals as well. When we spoke to autistic people and their carers, they said they'd like these resources to provide clear information, be accessible and user-friendly, and also signpost to existing resources whilst challenging some of the misconceptions around both autism and dementia. For professionals, we aim to educate them about autism in the context of dementia, highlight signs and symptoms of dementia, and also provide strategies for support and care. For the research, we had a cohort of people who supported this. This included autistic people, people with dementia, family carers, family members, professionals, and also researchers. So we held interviews and focus groups with these people and used reflexive thematic analysis to explore the main themes from the discussions that we had. This type of analysis is primarily used on rich transcript data and is best used with semi-structured interviews, so where people are more freely able to provide their views in their own words. 4 themes came out of these discussions. These were awareness, training and understanding, challenges accessing and navigating services and support, misunderstandings and assumptions, and practical support and resources. So just dive a little bit deeper into each of those. I won't read these excerpts out, so if you want to have a little read through while I give a broad overview, that would be fine. So in terms of the awareness, training and understanding, this came out for both people with lived experience and for professionals. People spoke about differentiating between both autism and dementia and teasing apart some of the traits or symptoms and find difficulties in doing so. And this was also linked to overlooking some symptoms of dementia as a result. People also said that communication between services was poor, and between services aimed at dementia and autism individually felt they were siloed, but of course conditions don't travel in the same way. And so they felt that these services were ill-equipped to support people with both autism and dementia, and so therefore a broader understanding of multiple health conditions would be of value, and therefore better communication and knowing how and where to send people to get the most appropriate support. Groups also spoke of the lack of support after diagnosis and the challenges in accessing and navigating those that did exist or do exist rather. People felt that they were sort of left to navigate these complex detached services without guidance and referred to a postcode lottery. I think Lou, we heard from Lou's experience of trying to find the right care home for her mum and having to go over 100 miles away to get that. So this kind of postcode lottery idea of knowing that the most appropriate services exist somewhere, but not within their area. In terms of capacity and decision making, some carers also spoke about not being spoken to by doctors and professionals, saying that assessing capacity was difficult and acknowledged that they felt they needed more training to support people. For misunderstandings and assumptions, there were lots of experiences of these. The group felt that raising awareness about autism and dementia together would go a long way in supporting this, but also felt that the leaflet should stress important points such as autism not being a learning disability, the different ways that symptoms of autism and dementia both present, and that everybody's experiences of both autism and dementia are different. And people also felt that there was too much focus on cognitive symptoms of both autism and dementia. And finally, in terms of the practical support and resources, a key point was that the leaflet should act as a platform rather than aiming to, provide all the information that exists. So it should be more of an accessible point of entry for people, that also directed to further resources if people wanted to have a deeper dive. Something that Lou mentioned, so signposting to the NHS Autism Passport, but as well as that, some benefits advice, information on lasting power of attorney. People often felt that some of these things were underused or difficult to navigate, but still felt that it was important to include them so that people knew about their existence. So yeah, they were the four themes, and we took information from these focus groups and interviews to inform the design of our resources. So we've got 2 so far. They're both aimed at autistic people and family members and carers. We've got a long version, but also a short version, because the long version got quite long. But yeah, some of the kind of content and tips that we included in there included talking about autism as a difference, not a strength or a challenge, just a difference in the way that which people experience the world. Acknowledging that not all people have a diagnosis, again, something that Lou spoke about, but highlighting that their experience of autism is no less valid, and that they still have the right to request reasonable adjustments. Autism is not a learning disability. We also encourage people to speak to their GP if they are worried about anything or any changes. And so we dedicated a section on there to what to expect at the GP. So taking notes, asking for a written summary after the appointment, taking the NHS passport, and also bringing a trusted family friend or family member who might notice some of the changes. We also refer to some of the advocacy charities who support when asking for reasonable adjustments. So yeah, if you want to find those, I'm sure the links will be sent out. But yes, I think I should, in the interest of time, probably leave it there. But we do have some illustrations that accompany our resources designed by Alice Haskell. So if anyone would like to ask any questions about that, I will be able to answer more fully later on. But yeah, thank you very much for your time and for listening. Yeah, thanks.
Thank you very much, Ryan. That was really interesting to hear about. So, in the interest of time, I will pass straight on to Dr. Gavin Stewart, who is a postdoctoral research fellow at King's College London, who's going to tell us a little bit more about the similarities in presentations in young onset dementia and autism. Thanks, Gavin.
Great. Hi, everyone. I'm Gavin Stewart, and as mentioned, I'm a research fellow at King's College London. So today I'll be talking about what the research says about early onset dementia in autistic populations, and I'll also highlight some broader considerations that help contextualize these findings. Before I begin, I always like to say that I'm not a clinician, I'm an academic researcher, but my research does have a strong clinical focus, and I work with lots of really wonderful clinical colleagues to conduct my research. So to start in my talk today, I'll present two very brief slides on what autism is and issues around age-related disparities in rates of diagnosis. I know that Ryan gave an introduction to autism, but I think there are a few points that are worth emphasizing again. I'll then move on to talk about the very limited research that we currently have on early onset dementia in autistic populations. And then I'll expand on this work with some other studies that might help contextualize these findings a bit better. And then I'll flag some limitations that clinicians have raised about how dementia is assessed in autistic populations before I wrap up with some opportunities for the future and some conclusions. So to start with the background. As Ryan mentioned, within a diagnostic context, autism is a set of highly heritable, lifelong, heterogeneous neurodevelopmental conditions. And the autism spectrum is characterized by differences in social communication and rigid and repetitive behaviors and interests. And there are other features that are commonly found to be associated with autism too, but these are not a requirement for diagnosis. We find that autism has a prevalence of between 1 to 3%, which means that in the UK, there are upwards of 680,000 autistic people in our population. But we find that rates of autism really vary across the globe. And we also find that rates of diagnosis, including in the UK, vary greatly with age as well, with far lower rates of diagnosis than 1% in adult populations. And this points to a big issue of underdiagnosis. I recently analysed some UK healthcare record data, and I was able to estimate that over 90% of autistic people over the age of 40 will likely be undiagnosed or misdiagnosed with another condition. And this is a really important consideration when interpreting research on autism in adulthood, as many of those who do have a diagnosis may have more risk factors for poor outcomes than those who are unrecognized. And we really need to think about the how representative our samples are, but also how generalizable our findings are to the wider population. Okay, so next I'll move on to what the research tells us about early onset dementia. So to date, there's only been one large-scale study specifically looking at early onset dementia in autistic populations. There have been a few other studies looking at dementia more broadly, but this study, which was published in 2021, is the only one that specifically focuses on early onset. And this was conducted by Giacomo Vivanti and his team, who are researchers based in the USA. And his team used data from over 1.2 million healthcare records, and the sample included 37,000 autistic people. And in their raw sort of unadjusted model, they found that autistic people were 4 times more likely to have a diagnosis of early onset dementia than the general population. And what they also found was that those with intellectual disability were also significantly more likely to have a diagnosis of early onset dementia as well. Giacomo's team did some further exploration of the rates of diagnosis too, which aimed to see whether being autistic was driving this association that they found, or whether other known risk factors were leading to this higher rates of early onset dementia. And what they found was that the autistic participants in the healthcare registry often had higher rates of several known risk factors for dementia, including higher cardiovascular risk factors, depression, and other psychiatric conditions. And these findings aren't overly surprising. We often find that autistic people of all ages often have higher physical and mental health burdens than non-autistic people. And when they accounted for these factors in their model, they found that risk for early onset dementia reduced down to a 2 times risk rather than being a 4 times risk. So this still suggests that there is an increased risk for autistic people to develop early onset dementia, But what we find is that known dementia risk factors are likely playing a key role in this relationship. So when I talk about the study, I always like to give a few caveats that I think are important when contextualizing these findings. And I do this with a lot of respect for Giacomo and his team, as their work has certainly helped highlight the lack of research on dementia and autism. But that doesn't necessarily mean that there aren't other things that we should be considering when looking at these findings. So on to my thoughts. This study uses data from a Medicaid registry. I imagine some of you might be familiar with the name Medicaid, but I also imagine many of you are perhaps less sure on what it actually is and the criteria for this type of health insurance. So in the USA, healthcare is private, with most people having healthcare insurance through their employer. However, they also have schemes like Medicare for people who have low income or who are disabled. It's worth noting that being autistic isn't a qualifying factor alone for Medicaid. So there are other factors at play that will make these participants eligible for this type of healthcare insurance. So the fact that they're eligible for Medicaid may suggest that there are wider societal factors influencing the results that are found in this study. It's also worth noting that while the study was published in 2021, the data was actually extracted from 2012, and this was before the current diagnostic criteria for autism came into effect, which could also influence the findings. We also don't know whether these findings are applicable to autistic people who were diagnosed in childhood, so perhaps a very long time ago, or those who are late diagnosed in adulthood. And along with this issue of when this data was extracted from, the type of data that they're using requires people to have an autism diagnosis in their healthcare record. However, as I flagged earlier, and as Lou flagged and also Ryan flagged, upwards of 90% of middle-aged and older autistic people are likely to be undiagnosed. So they can't be accounted for in this type of study design. And finally, just as a sort of a word of caution, saying something is 2 or 4 times more likely can sound quite concerning and quite frightening. But the reality is that the adjusted risk of early onset dementia was 2% compared to 1%. So the actual risk is still relatively low. So putting all this together, we need more sort of contemporary and representative research to really understand what's happening with the rates of early onset dementia in autistic populations. So next I'm going to move on to talk a little bit about some potential sources of risk and potential false positives when it comes to autism and dementia. So one place where we might be seeing some additional risk or even potential false positives is that some autistic people might be at risk for earlier cognitive aging. So in this study by Caroline Torenvliet, she found that around 20% of autistic people had what could be considered a deviant cognitive profile. So this just means that they have a lower than expected cognitive performance. They deviate from the mean. So in this figure, there are a broad range of cognitive measures listed by the letters along the x-axis, while deviation from average performance is on the y-axis. The majority of the autistic group fall into this blue line. However, 20% have a profile that deviates from the majority, being represented by the orange line. So given that around 20% of autistic people in the sample had below average performance across various cognitive domains, it may result in an old age cognitive profile emerging at a younger age. So by this, we mean that as people age and their cognitive abilities change, red flags and cause for concern for cognitive decline and dementia may present at a younger age than what would be expected in the general population. But we really do need more work on this area. Another consideration is that autistic people are often quite harsh on themselves when conducting self-appraisals. So we find that autistic people often self-appraise their cognitive abilities as being lower than what they actually are. And this work has also been led by Caroline. So in Caroline's work, her team didn't find any associations between age or objective cognitive task performance with self-reported cognitive complaints. So this highlights a mismatch between how people self-appraise and how people perform in actual real tasks. But one domain that Caroline did find a significant association was between poor mental health and self-reported cognitive complaints. And we often find that autistic people have poor mental health in the general population, which is also a risk factor for dementia. But it's also something that could predispose them to being more self-critical. So they could perceive their abilities to be worse, which means that they could be presenting more at memory clinics. Another area that might be quite important is that autistic people often experience periods of burnout, and this work has been led by one of my colleagues, Dorota Ali. So the concept of burnout is actually quite poorly defined. The World Health Organization view it solely within the context of workplace-related chronic stress. And this has three key markers centered around prolonged energy depletion, mental fatigue and disconnection, and reduced efficacy. But this framework has been applied to autistic people. And this application is centered around that existing in a neurotypical majority world as a neurominority can lead to chronic burnout. And it manifests as extreme long-term exhaustion, including periods of catatonia, loss of function, including to cognitive abilities, physical capacity, and emotional resilience, and also as reduced tolerance to external stimuli, so not being able to cope as well with touch or noise or light. So could people experiencing burnout be mistaken for someone with early onset dementia? It's not really something that we know, and there definitely needs to be more work in this area. And what we find as well is that people often share their lived experience and sort of echo these sentiments in interview studies. And this work was led by Dana Francis, one of my former students. So just very quickly here, we've got two people talking about their experiences. One person saying that their cognitive abilities are getting worse and she feels like she's losing her abilities. And another person talking about their experience of burnout and needing to be hospitalized. It is worth noting, though, that both of these people were diagnosed with autism at the time. But what would happen if they weren't and they spoke to their doctor about their concerns? Could this be concerned as early cognitive decline? We also have other experiences like menopause that could be playing a role. So many autistic people report more challenging menopausal transitions, and this is likely due to a higher number of pre-existing risk factors for menopause-related difficulties. So Christine Jenkins led a study and they found that brain fog and sleep disturbances were very commonly experienced, and many of these difficulties were unexpected. And we find that sleep problems in particular are very common in autistic populations. And this work was led by Sophie Roper, one of my former students. So Sophie found that sleep difficulties were very common, and around half of our autistic sample had moderate to severe difficulty with sleep disturbances and daytime dysfunction. And chronic poor sleep has been identified as a risk factor for dementia, but the exhaustion caused by sleep problems alongside other difficulties like burnout could also be viewed as cognitive decline. Okay, I'll just very quickly touch on some clinical limitations before I move on to the final few slides. So clinicians have cautioned that we don't have validated tools to properly assess dementia in autistic populations. So we need to make sure that these tools, the tools that are being used in the clinic are working as intended. And if not, then new tools need to be created. And we also need to make sure that adult service clinicians are autism aware, as many autistic people may not be formally diagnosed as autistic. Okay, so I'll wrap up now. I think it's really important that autism researchers look to the existing literature on dementia and use that as a framework for moving forward. So, for example, the Lancet Commission has identified modifiable risk factors for dementia, but these haven't really been examined in relation to autism and dementia. And it's important that we don't spend time recreating the wheel and we look to what's already been evidenced in the general population. We also need to be thinking about who's taking part in our studies and the limitations of our work. For example, registry studies are big and powerful, but there are limitations to who can take part in them because of the requirement of a diagnosis. We also have other approaches like using trait-based approaches, which can account for underdiagnosis, but we can't be sure that those people would actually meet diagnostic criteria for autism. But together they can help triangulate our findings while we address the underdiagnosis problem. But as we proceed, we really need to be mindful that risk may not look the same in both groups. People with an autism diagnosis could be very different from those who have yet to be recognised. So my conclusions, there's some evidence that autistic people may be at higher risk for early onset dementia, but overall this risk is low and the studies providing this information do have limitations. And one of these is the underdiagnosis problem, which we need to properly address to be able to understand what's happening to autistic people as they age. We also know that our tools for assessing dementia are limited and largely untested, and these need to be validated for proper clinical use. Importantly, we know that we need to continue focused study of dementia in autistic populations to understand whether dementia risk, but also dementia development looks different in autistic people compared to the general population. And it's really important that we include autistic people in this sort of research that we're doing. And we also need to make sure that the information is reaching the right people. So this includes people themselves and their supporters, but also there needs to be wider awareness and understanding of autism in older age, particularly for clinicians. If they aren't equipped with the knowledge about underdiagnosis and the experience of autistic people, then they aren't equipped with the tools to properly support them. So that brings me to the end of my talk. I hope this has been an interesting overview. To finish, I'd like to thank all my collaborators and also our funders and all of the autistic people who have supported the work. If you have any questions, my email's at the top there. And I've included 2 QR codes. One's for a recent review on autism and aging that I wrote, and the other's for my group newsletter if you're interested in hearing more about our autism and aging research. Thank you very much for listening.
Thank you very much, Gavin. That was really interesting, and I have to admit, autism and dementia is not a topic that I'd spent a lot of time considering. So it's been really helpful just to get the overview that both of you, I don't know, Brian, if you want to stick your camera back on as well, that you've both shared, and obviously hearing Lou's experience at the start, lots of food for thought for me as well. So I could just encourage, if anybody has a question, please stick it in the question and answer if you've got access to that, or stick it in the chat. We've got about 7 minutes, so we've got one here already, so I'll just go ahead and read this. It's from Nicole Mitchell, who's in Cornwall. Gavin, in your presentation, some feedback on one of your slides mentioned how dementia shows up differently for people who are autistic. Can any of the panel offer what those differences may look like, please?
So I think a big part of this is that autistic people often have what could be considered a sort of a spiky cognitive profile. So as people get older, they will experience sort of natural changes to their cognition. But what might happen is if one of those cognitive domains that are perhaps a slightly weaker area for them, if that decreases in a very natural way, but they could reach a point of that sort of clinical concern. So they might be aging relatively normally, but have a more sort of sharper decline in some areas than others because of the sort of the peaks and the troughs that we often see. But there's also other behavioral aspects. So sensory sensitivities is quite a common thing within autism, and the sort of tolerance for certain sensory stimuli might change as people get older. So they might become more irritable and other things like that. So they could present in slightly different ways than maybe what would be expected for someone who is non-autistic and is sort of presenting at a memory service.
Lovely, thank you. Another couple of questions have come in there. Thank you for putting them in the chat or putting them in the question and answer. So this is from Penny Lane. So how accurate was the young onset dementia diagnosis in the USA study? As we know that there are issues with this in the UK.
So I think with that study, obviously I gave a lot of my sort of cautions in interpreting those findings. This will be a registry study, so people will be the clinician will be uploading their updates for that patient into the records with, let's say, diagnosis and also the early onset dementia diagnosis. So that will be down to that sort of the individual clinicians who are providing that information. What I would say is that we know so little about this, and I would say very few clinicians are probably well equipped with the knowledge of autism and also dementia. So I would take the findings with a pinch of salt, but I also think that it is an area of concern, and a lot of lived experience accounts have spoken about, the concerns in this area and cognitive decline and other clinical anecdotes. I think there needs to be some UK-based study of this, but I think the issue of the validity of those diagnoses needs to be far more it needs to be sort of refined a bit further, and perhaps a slightly smaller scale clinic-based study would be more appropriate with a team who are very well equipped to be making that sort of diagnosis.
Lovely, thank you. The next question is from, I can't see the full name, I think it's Rebecca Kirkwood, so apologies if it's not Rebecca. When assessing dementia in a memory service, is there anything we can do to ensure accurate assessment, especially if the person does not have an autism diagnosis? Well, considering we don't have validated tools.
So I think with this, it's perhaps thinking about the sort of speaking with the person and trying to get a sense of what their sort of abilities have always been. If they have particular sort of strengths and weaknesses that they've always had, that might help explain discrepancies perhaps in some of the findings that they're having with these sort of cognitive assessments and things like that. But again, as I mentioned, we don't really have any validated tools, and we know that asking someone to complete a cognitive test battery can be quite stressful. It's quite an artificial experience. So are you picking up on the stress of the clinic with perhaps they've sat in a noisy waiting room, which has maybe sort of caused a lot of sensory stress. They're then in a room where they're being asked to complete these tasks with sort of artificial light that might be buzzing slightly, which is causing more stress. There's lots of things that can be going on there. But I think it's maybe just sort of trying to dig a little bit deeper and having that sort of awareness that a lot of autistic people are undiagnosed, and sort of trying to upskill in your knowledge of autism can be very helpful, especially if they might be more likely than the sort of the general population to be accessing this type of health service.
Thank you. And I would assume then that the Dementia UK resources would be helpful for that as well. Ryan, we're just a little bit short on time. We've got a minute left, so I'm going to just round it up if you don't mind. But yes, so thank you, Gavin and Ryan and Tulu, for your time this morning and for sharing this really excellent insight into the sort of starting of our understanding of young onset dementia and autism, and I look forward to seeing it being developed. Thank you to everyone for attending today. We really appreciate your time and I hope that you found it useful. We will follow up with you all with an email with the recordings, and any questions that we've not got to, we'll make sure they're answered within that follow-up email as well. And just to remind you that if you sign up to the network, you'll get the updates on the next webinars, but our next webinar is on the 18th of June, and that is on new insights in working with dementia that we're excited to share with you then. So thank you to all our speakers, thank you to our attendees, and we'll see you on the 18th of June.